Hello, Mr. Broman's been nice enough to allow us to film him today, and what we're going to do is a little bit of Restylane injection for some line softening, Restylane being a stabilized hyaluronic acid gel, and in our practice really the workhorse of soft tissue augmentation in a synthetic market. Mr. Broman has, if we can rotate the camera a little bit, Mr. Broman has these traditional kind of nasolabial lines that come down well beyond the oral commissure and extend as these laugh lines that come down below the angle of the mouth. And our goal today is really just to provide a little bit of softening in these respective areas. And if I can take the opportunity to draw a little bit, what we're going to try and do is just soften up these features right in here so that we kind of get a more natural tapered effect of the nasolabial lines down into the angle of the mouth. So what we'll do is get Mr. Broman numbed up, and then we'll show how we inject the actual product itself. So Mr. Broman's all numbed up. We took the liberty of injecting some lidocaine with epi in the area of injection. The injection can be done without local anesthetic, but I think it's a little kinder. The product hurts a little bit. It's a little bit on the acidic side, so it's a little bit uncomfortable being injected into the tissue. And there's a variety of different ways to actually inject the product. It's a clear translucent gel. I like a micropuncture technique where we march along the area to be corrected. I think it gives a little bit more of a uniform level of improvement. Some people like more of a linear threading. I think it's very dependent upon the individual's comfort level. You certainly can get very equivalent levels of correction with either technique. So we're just going to march along the limits of the area to be corrected. And if we've done our job effectively with the local anesthetic, Mr. Broman will be fairly comfortable. You feeling much of that? Okay. And we'll do the one side, and we'll come over here and we'll do the opposite side. And after we get the product in the tissue, and I really think it's quite helpful. And again, there's a variety of different techniques to do so. I typically tend to use a Q-tip, and it's a very soft, pliable gel that I like to work into the area to minimize any real transition areas between the areas that have been injected and the areas that have not. Do a little bit on the opposite side. We'll get Mr. Broman to use some ice packs for the upcoming evening, and perhaps everybody has the possibility of developing a little bit of bruising the next day. It's usually relatively short-lived. And we thank Mr. Broman for allowing us to film him today.